I'm Dr. Iris Chaconis. I've been a neurologist for more than 30 years, and I joined Memory Movement Charlotte in 2017. I've been a caregiver, and I recognize the importance of the additional time we spend with our patients and families. That's a huge part of what drew me to MMC. I treat a wide range of neurologic disorders, but primarily Alzheimer's and other forms of dementia. So let's talk about cognitive aging and dementia. We all age. Our faces age, our bodies and our joints age, and of course our brains age too. Normal cognitive aging happens to everyone and is very predictable. We may misplace things, we forget names, we enter a room and can't remember why we're there. That's very common. We're not as good at multitasking. The ability to filter distractions and jump from task to task is reduced. Learning new skills like how to use the latest technology is more difficult than it used to be, and it takes us a little longer to figure out what's going on in a given situation. These are all a normal part of aging, and understanding and accepting that can prevent anxiety. Hold these changes lightly. But some memory loss is not normal, such as mild cognitive impairment, which affects about 10 to 20% of the population. It's defined as a decline in cognitive function while retaining the ability to perform all daily activities. Often it shows up as short-term memory concerns, and an individual can compensate for it. MCI does not guarantee that you will develop dementia, but 70% of people with MCI will at some point develop dementia, and 30% will either improve or stay the same. Dementia is a syndrome, a complex loss of previously acquired cognitive abilities that definitely interferes with social and occupational function. Dementia is considered an umbrella term, and there are different types. Symptoms can include short-term memory loss, visual spatial changes, language challenges, and declining executive function, which is the inability to solve problems. The most common type of dementia is Alzheimer's disease. About 70% of people who develop dementia after the age of 65 years have Alzheimer's disease. It's not only the most common type of dementia, but also the most predictable. The cause is still not fully understood, but it seems to involve the development of protein plaques called amyloid and tangles called tau, and these interrupt brain pathways and cause brain cell death. The second most common type is known as vascular dementia, which is commonly associated with multiple strokes or changes in brain blood vessels due commonly to elevated cholesterol, diabetes, and hypertension. The third dementia is known as Lewy body dementia, and this is often associated with symptoms of Parkinson's disease. It's caused by abnormal protein deposits called Lewy bodies in specific areas of the brain that interrupt cell communication. The fourth type of dementia often occurs prior to the age of 60. It's called frontotemporal dementia and is caused by changes in cell communication, predominantly in the frontal part of our brain. There are other causes of dementia, including CTE, or chronic traumatic encephalopathy, which is the result of multiple concussions. Dementia can also be caused by exposure to chemicals such as Agent Orange from the Vietnam era. Every person experiencing memory loss presents differently, and that's why we spend so much time trying to identify the parts of the brain that are involved and what's unique about each specific patient. It can be difficult to diagnose dementia in the early stages, but sooner is better. If we know there's a problem in the early stages, the patient can learn strategies to compensate for memory losses and together with caregivers prepare for the future. So how do we treat dementia? There are medications we prescribe for memory. These drugs can ease symptoms, they can enhance the ability to stay independent, and enhance the ability to engage with others and enjoy people and activities. Researchers are working to find an effective treatment and cure. We can also use medications to manage anxiety, as well as depression, altered sleep patterns, irritability, and other changes in mood that frequently occur with memory disorders. These are prescribed based on the day-to-day impact of mood changes. We're often asked about supplements that claim to improve memory. Often the clinical data is not sufficient to support this claim. Also, supplements are not studied in combination with prescribed drugs, so the interaction is not known. For these reasons, we only recommend supplements that are based on findings from blood work, and we will recommend those if actually needed. While there isn't a cure yet, there are many medications to prevent, reverse, or slow the progression of dementia currently being researched. All the clinicians at Memory Movement Charlotte are continually monitoring and evaluating these as possible treatments for our patients. In each case, we weigh the effectiveness of a new drug against its risk of dangerous side effects. Nobody wants to find a cure more than we do, and we welcome inquiries from patients and families about current research. So, what should you expect as the condition progresses? Mild cognitive impairment in each of the dementias progress differently over time and have unique characteristics. As I mentioned, 30% of people with mild cognitive impairment will stay the same or even get better. On the part of the patient, if you recognize you have memory loss, we can teach skills that make you more effective in the early and moderate periods. The goal during the earlier stages is to focus on the 90% of what is working and not the 10% that isn't. It is too easy to mourn the loss of what we had, which prevents us from making a life out of what we have left. If a person is diagnosed with Alzheimer's disease, the progression of the disease is slow and the decline is gradual. The person often doesn't recognize that their memory is failing, which can create challenges. Short-term memories fade first, resulting in misplaced objects, missing appointments, and repetitive questions. Over time, long-term memories also fade. Regardless of the memories lost, a person with Alzheimer's disease always recognizes the heart connection they have with the people in their lives. Vascular dementia presents with a different picture. A person with the old-fashioned hardening of the arteries has memory loss in a stair-step fashion rather than a steady decline. The person stays the same for a long period of time, then has a step down in their ability to remember things. Then they stay at this new stage for a long period of time again. Apathy, which is loss of the desire to do things, and anhedonia, which is loss of pleasure in things that used to bring pleasure, are common symptoms. Lewy body dementia is associated with Parkinson's disease, so both memory and movement challenges may be present. As the dementia progresses, hallucinations, unpredictable changes in attentiveness and alertness, and illogical thinking occur. Over time, a person will develop challenges in thinking and processing similar to Alzheimer's disease. Frontotemporal dementia tends to be diagnosed before the age of 60. Each person is unique with regard to how quickly symptoms progress. Behavioral issues that are not recognized by the patient are a hallmark of the disease, things like poor judgment and impulsivity. Dementias from other causes such as chronic traumatic encephalopathy or exposure to chemicals such as Agent Orange present with unique symptoms that progress over time in unpredictable ways. With every dementia diagnosis, our focus remains the same: learning to manage each stage through education and support and to focus on what is working. At every stage of this journey, we identify what a good day looks like and find ways to replicate it.